So I'm here with Seydou Traore and to speak to you today about our experience working with religious leaders in Mali around a very sensitive topic, which is gender-based violence. To start off, I'd like to ask our audience members if you could type in the chat where you're participating from, and if you have worked with religious leaders, which faith. I'll give a second for folks to just type into the chat so we can get an idea of who's joining and their experiences. I know we have Malawi, and I know they have worked with both Muslim and Christian leaders. I think I saw some Kenyan colleagues on the line as well. Okay, maybe we'll get a sense of who is joining as people have time to chat in the chat box. So let's go ahead and go to the next slide, and I can keep an eye on the chat. So Mali is a very religious country with approximately 95% of the population reporting to be Muslim and about 2.5% who are Christian. Traditionally, faith leaders have had a very strong influence in Malian society overall, and also in government decisions and policymaking. While this did decrease somewhat after the political crisis of 2012, with the recent military coup in August 2020, we see an increase again. HP Plus has a long-standing partnership with the religious leaders from our previous project, Health Policy Project, and we work with Muslim and Christian groups and organizations to encompass leaders of both faiths and both genders. Great. Hi, Christine. Nice to see you on the line. Okay, let's go to the next slide, please. So in Mali, GBV is a significant health and social issue, as the previous DHS, the demographic health surveys, have repeatedly shown. In addition, maternal and infant mortality are high, and the modern contraceptive rate is relatively low at 16% as of the 2018 DHS among married women. So combined, these health indicators tell us there's a significant opportunity for improvement. And the religious leaders have historically believed that the holy texts of the Bible and the Quran support GBV. And because of their lack of understanding about GBV, they have blocked any advocacy or policy efforts to reduce GBV. Next slide. So as mentioned, HP Plus had an existing partnership to build upon for this activity. Through this partnership, we had established trust with them over the previous 5 years to discuss sensitive topics such as family planning and HIV. We were working on GBV in other parts of the project, but for several years, the religious leaders weren't willing to really discuss this topic with us. Thus, given their long-standing reticence to address the topic, we proceeded very slowly and followed their lead. At one point, they brought up the issue and their concern about how GBV was affecting their congregation. The way they opened up, based on the trust they had with us and their desire to address the issue, is what we consider innovative for Mali. The Alliance of Muslim and Christian Religious Leaders and another religious Muslim leader network called RIPAD were the two main groups that we partnered with for this activity. So first, we focused on capacity building, strengthening the leaders' capacity through trainings and workshops to help them understand the statistics in Mali and the implications on their congregations, and to give them the language of GBV. This is how we had also started with family planning and to co-develop their strategic plan. And this is important because in their strategic plan, they needed to add working with GBV on the topic of GBV. And it also helped formalize their organizational structure and functioning, enabling them to eventually receive funding and to better define how different health stakeholders could engage with this alliance on various health issues. So we worked with the members to review the various challenges they faced as they worked to promote reproductive health, family planning, maternal, newborn, and child health, eliminating stigma around HIV, so we could help them be prepared for addressing GBV. One key request of theirs was to have tools that they could use to address this topic. So we facilitated a workshop to help them identify the passages in the Quran and in the Bible that speak against GBV. And the Christian leaders worked together and the Muslim leaders worked together to review their respective texts. Then we worked with the national program against GBV to verify the conformity of those passages with the content of a draft law that was being worked on against GBV. And this helped the faith leaders develop standard, specific, faith-based talking points on GBV and provided a foundation for future advocacy targeting different decision-making groups. So after launching the talking points, or argumentaire in French, the Alamarf proposed holding community meetings across Bamako to share the information. At the same time, HP Plus was also working with the National Program Against GBV and different women leaders to advocate for passage of the law. And prepared with their knowledge about GBV and the talking points, the religious leaders joined the advocacy efforts to support passage of the law. Now, next slide, please. Through the different imams and pastors, they organized sessions to disseminate the talking points with their own peers so they too would understand that Islam and Christianity do not support gender-based violence. And this reached over 250 leaders. The religious leaders have told us that whenever they have the opportunity, they discuss HIV, stigma reduction, birth spacing, and now GBV with their peers and followers. They weave in these topics as they are counseling couples ahead of marriages and when families have challenges. They are doing this now without HP Plus's support, along with their increased confidence and capacity on the subject matter. Slide, please. They also continue to use tools previously developed by HP Plus, and you can see some of those, and the links are on the slide, and work with partners at the Ministry for the Promotion of Women, Children, and Families and the Ministry of Health and different women's groups to continue promoting abandonment of GBV and passage of the law. And as an example, several imams dared to speak out early last year when text of the GBV law was leaked on social media to correct the interpretation of what was being shared. They are connected to each other around this topic and are respected in Mali and even within the Ouagadougou Partnership region for their engagement in health issues. Unfortunately, due to the current political situation, HP Plus is no longer working with the religious leaders or others on the GBV law. We do, however, continue to partner with them to answer their questions about health issues, and we have co-organized COVID vaccine education and administration events. And we know that the Muslim group REPOD received donor funding to continue working on GBV and other health issues, utilizing the capacity strengthened through their partnership with HP Plus. Next slide, please. So thank you for listening to our experience about religious leaders in Mali. These resources on the slide are those that we worked on that address family planning and other health issues. And we know that it takes time to build trust with religious leaders to help them understand a topic deeply from the religious and public health and policy perspectives and to chart a path of collaboration. And we know that this approach works. Thank you, and we'd love to hear your questions. Very quiet groups today.
Hello, can you hear me?
I could ask, did somebody have a question?
Yeah, I have a question. I think for context, first of all, awesome job on this Mali work on the gender-based violence. And for some context, I'm from Indonesia, which is also a Muslim majority country, and I'm also a Muslim. But I think when taking back into the local situation, we see. I'm just curious about the lessons that you guys learned in Mali, because I think the imams here in Indonesia, they are not a lot of them actually are supportive of eradicating gender-based violence, and a minority of them actually promote gender-based violence. And second of all, how do you deal with the political situation? I don't know. how it's going there in Mali, but in Indonesia, uh, a lot of these imams also take up a political position in the government. So I'm curious to see what you guys have found out over the years. Thank you.
Ma question. Bon, il est de l'Indonésie et là, ils ont beaucoup des imams qui sont aussi contre, qui sont supportifs de GBV en fait. Donc, quelle était votre expérience pour approcher ces types d'imams qui sont contre pour le convaincre que le GBV n'est pas bien, VBG n'est pas bon et pour travailler avec eux. Aussi, il y a d'autres.
C'est une approche qui a commencé depuis un certain nombre d'années. Et d'ailleurs, de cette approche est avec nous, Modibo Maïga. Donc, c'est une approche qui a commencé depuis longtemps avec l'identification des champions parmi les religieux. Comme il a dit, il y a beaucoup de religieux qui sont opposés à toutes ces approches-là. Mais il y en a aussi champions qui sont là, qui sont très importants, qui sont aussi influents, qui sont très influents et qui ont les arguments, des arguments religieux. C'est des arguments tirés du Coran, du Saint-Coran et puis de la Sainte Bible pour affronter ceux qui sont contre. Et donc, nous avons été, je crois que, comme je l'ai dit, et ces champions étaient identifiés, outillés, formés, organisés. Et c'est eux qui ont mené le combat. Vous imaginez comment sa question a été posée. Sa question sous-entend, nous, on n'est pas devant. Mais c'est les imams et les imams, ces champions qui sont devant pour donner les explications nécessaires avec des argumentaires religieux. Vous voyez sur le diapo que vous avez actuellement, vous avez l'imam Cham, qui est un imam très important au Mali, qui est membre du Conseil islamique national, le Haut Conseil islamique national, et qui est avec la ministre. Et il est en train de remettre à Madame la ministre de la Promotion de la Femme, de l'Enfant et de la Famille un argumentaire religieux contre les violences basées sur le genre. Donc, c'est des argumentaires qui sont élaborés à partir de versets du Coran. Et ces versets montrent effectivement que les violences basées sur le genre ne sont pas acceptables par l'islam.
Okay, so thank you for the question. In fact, as I was sharing, this is an approach that we've worked on for many years, and one of our colleagues who really started this approach, Modibo Maïga, is with us. And what we really worked on, or the approach that we took, was really to identify champions, because as you rightly noted, there are many imams who don't support working against GBV. In fact, noted, as you said, but there are some who are really against it. And so what we did was to really work through their network and identify those champions. And so you find those champions, and then you help them understand the topic, give them the tools and the messages and the language really to use, and to help them look through their own text and to pull out those verses that speak to them and that they can use to speak to others. And he was describing the photo that is here on the screen, and on the left, your left, is Imam Cham, who is a very highly respected imam in Mali. He's part of the High Council of Islam, and he's passing the argument, the talking points that we worked on together to the minister of the Ministry for Promotion of Family, Women, and Children. So it's a long process, but you need to identify those champions and then give them the tools and the language to use to work against GBV.
Et bon, je voudrais ajouter que, comme il le sait, il y a des courants, il y a plusieurs courants dans l'islam, et ces champions sont issus de tous les courants. Donc, c'est très important.
Right, that's also very important. There are different sects within the Muslim faith, and so they looked for messages that would respond to those particular belief sets as well.
Ça permet de faire en sorte que les sunnites s'adressent aux sunnites, les chiites aux chiites, et d'autres, les courants différents, chacun son imam, parce que c'est une question de groupe, c'est une question d'orientation, et cet aspect est assez sensible. Donc, nous faisons en sorte que on puisse éviter qu'un groupe parle à un autre groupe, pour que les gens, on respecte leur orientation, mais respectant aussi leur structuration.
Yeah, so let me just quickly translate that. As I said, we worked on messages that went to both of the Muslim groups, and that is very important. And we took that into account so that they would feel comfortable also talking to their own congregations. And I think Mackenzie is telling us that we need to conclude. I see there was an important question about challenges, but unfortunately we don't have time to get to that.
Just maybe
Thanks,
before you
Mackenzie.
conclude, if you allow me just one word. Just one word to congratulate you and to say you what we are very proud of what you are doing in Mali. I think this is really excellent. And I know that based on all what you have been doing, also that this organization received also funding from other donors. And this has to do with the sustainability of what Health Policy Plus has done in Mali. Thank you so much.
Thank you so much, Modibo, for that final comment. And it's time now to go ahead and return to the plenary.